welcome again. Today we are going to learn something about a drug which is useful in the management of painful inflammation. And that drug, the name is Aceclofenac. Now let's try to understand what is Aceclofenac and what is it used for. Aceclofenac belongs to a group of medicines. It's called as non-steroidal anti-inflammatory drugs, or in short, NSAIDs. These drugs have inflammatory and painkiller properties, and the active ingredient of aceclofenac tablets is obviously aceclofenac. How does aceclofenac work? Aceclofenac works by blocking the production of some hormone-like substances, which are called as prostaglandins. Prostaglandins are released at the site of injury, tissue damage, and immune reactions. Prostaglandins play an important role in both inflammatory response of the body and stimulating the reabsorption of bones in certain diseases. Aceclofenac is used to relieve pain and inflammation in patients suffering from arthritis of the joints, commonly known as osteoarthritis. Now, this osteoarthritis occurs more in patients over age of 50 and causes the loss of cartilage and bone tissue, which is adjacent to the joint. Then it is also used in certain autoimmune diseases that cause chronic inflammation of the joint. For example, rheumatoid arthritis. It is also used in the arthritis of the vertebral column, that is spine, which can lead to the fusion of the vertebrae. This condition is called as ankylosing spondylitis. What do you need to know before you take aceclofenac? Please remember, do not take aceclofenac if you are allergic to aceclofenac or any other ingredients of the formulation. Then, if you are allergic to aspirin or certain other NSAIDs, the commonly used ones are ibuprofen, naproxen, diclofenac, etc. Diclofenac, by the way, belongs to the same family of aceclofenac. If you have taken aspirin or any other NSAID and have experienced one of the following conditions, for example, an attack of asthma or runny nose, itching, and or sneezing, that is irritation of the roots, then raised red circular patchy skin rash over the skin, which may be itchy, or you can give a sensation of burning sensation, or severe allergic reaction, which is also called as anaphylactic shock. Now, what are the features of anaphylactic shock? They include difficulty, severe difficulty in breathing, wheezing in the chest, abnormal pain, predominantly the stomach, and vomiting. Then if you have a history of, or suffer from, or suspect that you have a stomach ulcer or intestinal bleeding, if you have a very severe kidney disease or severe liver failure, or in the past, if you have had a very severe heart attack, and if you also suffer from certain bleeding disorders. Now, what warning and precautions one has to undergo or one has to keep in mind when one takes aceclofenac? So before taking aceclofenac, please tell your doctor if you are having some sort of problem with the liver or kidneys. Then if you have certain disorders like gastrointestinal diseases, upper gastrointestinal or lower gastrointestinal, then certain inflammatory bowel diseases, the commonest is called as ulcerative colitis, where you develop ulcers in the large intestine. Chronic inflammatory bowel disease, for example, there is a condition called Crohn's disease. Or if you have ulceration or bleeding or perforation anywhere in the gastrointestinal tract, or if you have bleeding disorders, blood disorders. If you have had any problems with the circulation of the blood in your brain, if you have suffered from asthma or certain breathing problems, if you suffer from a bleeding disorder called porphyria, If you have heart problems, previously, suppose you have had some stroke, that is paralysis, or if you think that you are at risk of developing these things, for example, if you have got risk factors like high blood pressure or diabetes or high cholesterol, or if you're a smoker, then you should definitely discuss the treatment with aceclofenac with your doctor. Secondly, if chickenpox occurs, the use of this medicine has to be avoided because of certain serious infections of skin can occur if you use aceclofenac, or if you are recovering from a major surgery. Remember, if you are an elderly person, then your doctor will obviously choose the lowest effective dose over for the shortest duration. Hypersensitive reactions can occur, and very, very rarely, very serious allergic reactions can occur. They generally occur in the first month of treatment. Generally, NSAIDs and aceclofenac is generally not given for more than 15 days at a stretch. Medicines such as aceclofenac are also associated with a small increased dose, as increased risk of heart attack, that is myocardial infarction. And as you know, any risk is more likely with higher doses and with prolonged treatment. Please do not exceed the recommended dose or the duration of treatment. What about other drugs which you are taking already with aceclofenac? Please tell your doctor if you are taking certain medicines which are used to treat depression, like selective serotonin uptake inhibitors or manic depression. These are certain psychiatric disorders. Then medicines used for heart failure or irregular heartbeats. The commonest drug is digoxin. Medicines which are used for high blood pressure, antihypertensive. Then certain antibiotics which are called as quinolone antibiotics, like ciprofloxacin, norfloxacin, etc. Then drugs which are used to increase the rate of urinary excretion. These drugs are called as diuretics. Medicines that stop blood clotting, for example, anticoagulants like warfarin and heparin. Methotrexate, this is generally used in the treatment of cancer or certain autoimmune disorders. Then certain steroids, estrogens, androgens, glucocorticoids, etc. Medicines which are used to suppress the immune system, like cyclosporin or tacrolimus. Medicines used in the treatment of HIV, particularly zidovudine. Medicines which are used in diabetes, anti-diabetics, including insulin. And of course, certain another NSAID like aspirin, ibuprofen, naproxen, etc., etc. Is aceclofenac to be given with food or with drink or empty stomach? What is it? Well, ideally, aceclofenac must be preferably should taken with or after food, not on empty stomach. What about usage in driving, or suppose somebody is using some machines? If you are taking aceclofenac and if you experience certain sensations like dizziness or drowsiness or vertigo, tiredness, fatigue, or some visual disturbances, please do not drive or please do not use the machinery. How to take aceclofenac? Always take this medicine which I told you earlier, that it has to be taken as prescribed or as advised by the doctor. You will be obviously prescribed the lower dose, the lowest effective dose over the shortest duration to reduce the side effects. Check with your doctor if you are not sure. Generally, the recommended adult dose is 200 milligrams per day. 100 milligram tablet in the morning and one in the evening after meals. Now remember, a tablet should be swallowed wholly with plenty of water and should be taken with or after food. Please remember not to crush or chew the tablets and do not exceed the daily recommended dose. Again, how about usage in elderly? Well, if you are an elderly person, you are more likely to experience certain serious side effects. So if your doctor prescribes aceclofenac for you, you'll be given the lowest dose for the shortages. Obviously, it has to be effective.